We all know that hearing aids are for hearing loss, but what if somebody's deaf, especially in just one ear? Well, to explain, I'm here with audiologist Dr. Gnewikow, and I know I've seen this in people before where they're deaf in one ear and they kind of like tilt their good ear to me to talk to me. Can you help fix that? Like, how do they hear then?
Well, first of all, if you have normal hearing in one ear and you're completely deaf in the other ear, it's generally not a problem as long as you're in a quiet environment. A lot of people have this and they really don't do anything about it because they say, well, I kind of get by. Basically, a sudden change in hearing, sometimes of viral origin, can happen overnight, and probably most of the people listening to this know someone who's deaf in one ear. Many times that can be dealt with if you deal with it quickly through your physician, but occasionally you can't bring it back. So you end up spending the rest of your life being deaf in one ear. It has some implications. You're not going to be able to tell where sounds come from anymore, so if you're a deer hunter and you've lost hearing in one ear, it's kind of hard to pinpoint the sound. You're going to have difficulty when people are more on one side. So say I'm deaf in my right ear and I'm driving a car. Well, they're talking on my deaf side, and although my left ear will certainly pick up part of it, it's going to be difficult, particularly if there's background noise. So being deaf in one ear is a handicap to a degree. And of course, if you're completely deaf in one ear, a hearing aid won't work. Just like if you're completely blind, glasses, a prescription on one eye will not really help you. So what we can do is a device called a CROS, C-R-O-S. The acronym stands for Contralateral Routing of Signal, a 25-cent word, which basically means you pick it up on one side and you put it in the other. So just as a demonstration, I have a hearing aid in one ear. You can kind of zoom in on that a little. And let's say I'm deaf in my left ear. So putting a hearing aid in is a waste of time and money. But you can take a little device about the size of a hearing aid, and it simply lays over your ear, much like a hearing aid, and a little tube holds it in place. It's very inconspicuous, but it's not a hearing aid. So what it does is it picks up the talker on the deaf side, and it wirelessly transmits their voice to the right side.
Wow.
It doesn't resolve the issue of telling where sounds come from, because in order to determine sound direction, you have to have two balanced ears. But what it does allow you to do is to allow you to hear people on the deaf side, particularly when they're speaking softly, or you're in a background noise situation, or as I mentioned, driving a car, or perhaps you're a passenger and it's your left ear. So it picks up a softer signal and puts it to the other ear. But although we can't solve the issue and we can't bring back the hearing in that ear, we can make the problem a lot less noticeable and a lot less difficult for the patient simply by making the talker over here sound like they're over here. So if you have a hearing loss like that and it's not bothering you and you're getting along well, go on as you are. But if you find, I really would like to be able to hear people on my left side, see your audiologist and ask them about a CROS hearing aid.
And is this something customizable for, say, children as well?
Children can use them, adults can use them. Typically with children we don't use it as much because, like with very young children, if the mother is holding the baby, she's close enough to the ear that it wouldn't be a problem. But as they get school age, the teacher may be walking around the room talking from the deaf side, and yes, it can be used on those, and it really does help.
And do you only wear one in one side, or is there something for the transmitter itself too?
The transmitter looks like a hearing aid. The other side is actually a hearing aid. So you wear two devices. If people saw you, they would think you had a hearing aid in each ear. However, it's really only one hearing aid and one transmitter.
And to learn more about CROS hearing aids or just general audiology information, Audiology Hearing Aid Associates has 2 area locations to serve you. In Lynchburg, they're located on Langhorne Road, and you can reach them at 434-528-4245. In Danville, they're on Main Street, and the number there is 434-799-6288. You can also learn more online at digitalhearingforyou.com.